brain and mindful of your brain. When was the last time that you engaged in a conversation without thinking of other things? We all have busy lives. We are bombarded with a lot of things, and our lives are mainly focused on the future. What do I have to do tomorrow? What projects do I have to present? Or things that happened in the past. Mindfulness is about being present, being attentive to your surroundings, and not being judgmental. It's not all about breathing. While breathing is part of mindfulness therapy or mindfulness meditation, it's not all about breathing. Breathing is to reconnect. Not unlike other meditation techniques where breathing is part of staying in one position, breathing and pretty much disconnecting, mindfulness is about connecting to your environment and staying present and being attentive. The following presentation is based on mindfulness cognitive therapies, mindfulness stress reduction. I based my studies using +1, support career cancer, and the psychology today. To start, I will use +1, minus. This study was done after 10 years using mindfulness. It took 10 years to actually determine that mindfulness can be used with clinical patients. Mindfulness has been linked to stress reduction by using techniques of staying aware. For this type of patient, we use descriptive scenarios. We have patients embrace the environment. This technique lasted 8 weeks with 2-hour sessions where patients had workbooks, audio videos, and they read books related to mindfulness. Now I'm going to move and give you some mindfulness exercises that you can try it anytime, any day, and they're less than 1 minute. So for the first one, we're gonna embrace what we eat. We all love to eat. 2-minute mindful bites. When you eat, we actually put something in our mouth and swallow it. We don't really pay attention after that. Mindfulness will let you identify what you put in your mouth, taste it, embrace it, and then swallow it. That's mindfulness. What on breath feels like. So breathing is part of this technique. Unlike meditation where you have to close your eyes and breathing and disconnect, with breathing in this technique, you take 2 breaths, inhale, and make it aware. Go to the whole process of breathing in and feeling the moment. Take a mindful moment to take a break. We usually fill up gaps of moments, checking our phones, going through emails during this time. And just like Alice Boyce on Psychological Today mentions, disconnect from that. Look through your window, and that's what she does usually in between patients. She looks through her window, she goes and she sees trees, how trees move, or how tree leaves move back and forth, and she disconnected from the environment. Air on exposed air. Short sleeves, feel the air. Feel how the air touches your skin. That's staying aware of your environment. Scan your body. Sometimes we feel upset. It's about disengaging, not being judgmental. So disengage yourself, understand what makes you feel bad, and try to correct that. Same thing, what makes you feel good, and embrace it. Do one action mindfully. Every day do the same thing. Those are quick techniques that you can do in less than a minute every day. All right, the next topic is mindfulness based on cognitive therapy. This was done on patients of cancer. Female patients, cancer patients. There were over 100 patients on this group. Same thing, 8-week sessions, 2 hours. Patient had workbooks, audiobooks, and the outcome for this mindful technique is that the patients improved their quality of life. By improving the quality of life, they didn't feel too much upset about their condition. They actually embraced the condition. They started living on the present, and besides thinking about the future. Some of those patients had thoughts of death, or what's going to happen with this condition, or they remember the past things that they had done, and because of the condition had changed. The next one that I'm going to talk is mindfulness based on stress reduction. And this one is another clinical one correlated to family members of patients with chronic conditions. This study was done in Western countries, mainly China or Hong Kong. And it demonstrated that patients that had or treat patients, this particular group of people that treated patients with chronic condition had a lot of problems treating or dealing with these patients. So what they did is that another 8-week program, questionnaires, they had to document the pre and post, and they found that after going through this therapy, they felt much better and they were able to take care of these patients. So what I had already discussed is mindfulness. Mindfulness is about being present, not being judgmental, being more attentive, staying on the now, and not focusing too much on the future and the past. The future is something that we cannot predict. The past is something that had already gone, and the present is what sometimes we don't embrace.
Yeah.